Afternoon, everybody. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on June 2nd, 2021. Next slide. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Next slide. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses and partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. The course access code is One Health 2021. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCE online by July 5th, 2021. A captioned video of today's webinar will be posted at cdc.gov/onehealth/zohu/2021/june.html within 30 days. To receive free CE for the web on demand video of today's webinar, complete the evaluation at cdc.gov/TCE online by July 6th, 2023. Next slide. Before we begin today's presentations, Dr. Casey Barton-Baravesh, Director of CDC's One Health Office, will share some news and updates. Please begin when you're ready.
Thank you, Laura. Hello, everyone, and thanks for joining us on today's ZOHU call. We really appreciate you being here today. Before our presentations, I'd like to share a few One Health COVID-19 updates and highlights from today's ZOHU call email newsletter. If you're not yet subscribed, please use the link at the top of the main ZOHU call webpage to subscribe so you can stay informed. CDC's response to the COVID-19 outbreak continues to evolve. Please check CDC's website for the latest guidance and resources, including information about keeping people as well as pets and other animals safe and healthy. We also hold a regular One Health Partners COVID-19 webinar to provide news, key updates, guidance, and resources for public health officials, animal health officials, veterinarians, physicians, industry and academic partners, pet owners, and others. And our next call is going to be on June 15th. You can email onehealth@cdc.gov to receive more information on how to join the webinar. Next slide. At this time, CDC is aware of SARS-CoV-2 infections in over 300 animals from 27 countries, including cases in companion animals like dogs, cats, and a ferret, in zoo, sanctuary, and aquarium animals, including multiple species of large cats, like tigers and lions, gorillas, and otters, and in farmed mink, which are counted by the affected farm and not the individual number of impacted mink, and also in a wild mink captured outside of an affected farm. We're now aware of 425 mink farms confirmed with SARS-CoV-2 in 12 countries around the world, and that includes 16 affected mink farms that occurred in 4 US states. Next slide. In the United States, we've got 203 animals being reported from 28 states with SARS-CoV-2, and you can see the species breakdown shown here on the slide. This is important because we're documenting about 65% of the global positive animals in the US, thanks to all the strong One Health work and active surveillance activities that are happening. The latest animal case numbers are available on the USDA APHIS website, and they also report confirmed positive animals in the United States to the World Organization for Animal Health, or OIE. You can find guidance for pet owners, mink farmers, veterinarians, and many others on CDC's COVID-19 Pets and Other Animals landing page. And we wanted to share the highlights from our current key messages on animals and COVID-19. At this time, there's no evidence that animals are playing a significant role in spreading SARS-CoV-2 to people. It's being primarily spread from person to person. Based on the limited information available to date, the risk of animals spreading COVID-19 to people is considered to be low, but there is a higher risk for people working on mink farms. And there are more studies needed to better understand if and how different animals could be affected by COVID-19. We will continue to keep sharing timely updates as the knowledge around COVID-19 and One Health evolves. Next slide, please. Some recent publications of interest include trends in agricultural triazole fungicide use in the United States between 1992 and 2016, and possible implications for antifungal resistant fungi in human disease. This was presented on the May 5th ZOHU call, so be sure to watch the video online if you missed the live webinar. Also, we've just released a One Health zoonotic disease prioritization report from Alaska. You can find that online. And the rabies surveillance in the United States during 2019 report is now available, as well as the others listed here. Next slide. There's some new web resources of interest. We wanted to point out a CDC podcast episode about animal reservoirs for emerging coronaviruses. That's linked with a recent EID publication in the Emerging Infectious Diseases Journal. And there's a video training for clinicians, including Lyme disease updates and new educational tools. Next slide. Here are some upcoming events of interest, including the Wildlife Disease Association's virtual conference, which starts on August 31st. And registration is now open for the International Conference on Emerging Infectious Diseases, or ICEID, which will be held here in Atlanta in March of 2022. Next slide. And finally, there are new salmonella outbreaks linked to backyard poultry in 43 states. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past US outbreaks of zoonotic diseases. Remember, we don't have a ZOHU call in July. Our next call will take place on August 4th. So please email topic suggestions for future presentations and news from your organization to zohucall@cdc.gov. We really appreciate your help in spreading the word about the ZOHU call with your colleagues and friends. So please continue sharing the website link and help spread the word to human, animal, plant, environment, and other relevant health sectors, and letting them know about the live webinars, as well as the free CE and video recordings of past webinars. Thanks again, and I'll turn it back over to Laura.
Thank you. Next slide. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You can also email questions to today's presenters. We've included their email addresses on this slide, on the ZOHU call webpage for today's webinar, and in today's email newsletter. Next slide. Our first presentation, Alaskapox virus, an emerging animal to human infectious disease, is by Dr. Florence Whitehill and Dr. Eric Q. Mooring. Please begin when you're ready.
Thank you so much. Good afternoon from Atlanta. My name is Florence Whitehill. I am a first-year Epidemic Intelligence Service Officer in the CDC Poxvirus and Rabies branch.
And good morning from Alaska. I'm Eric Mooring, Epidemic Intelligence Service Officer assigned to the Alaska Division of Public Health. Today, we will be telling the story of Alaskapox virus. Next slide, please. Our story begins more than 5 years ago, when in July 2015, a middle-aged woman living near Fairbanks, Alaska, presented to an urgent care clinic. She thought she had a spider bite on her right shoulder. She'd also been experiencing fatigue, fever, malaise, and tender lymph nodes in the few days before seeking medical attention. The clinician suspected a viral skin infection, and he sent a swab of the lesion for viral testing. Culture confirmed that the patient was indeed infected with a virus. Next slide, please. The specimen tested positive on a generic orthopox virus PCR assay, but negative on assays for specific known orthopox viruses, such as variola virus, the virus that causes smallpox. So the specimen was sent to CDC. Next slide. Whole genome sequencing of the virus led to quite a surprise. Not only was the woman infected with an orthopox virus quite diverged from other known orthopox viruses, the virus, shown in this phylogeny in magenta, was more closely related to a clade of orthopox viruses known as Old World orthopox viruses that are found in Africa and Eurasia, shown here in blue, rather than the so-called New World orthopox viruses that are known to occur in animals in North America, shown here in green. Next slide. The woman herself had not recently traveled outside of Alaska, so investigators were confident she was infected in the state. But where did the virus come from? Was it imported? Is it endemic in small mammals in the area? Notably, the patient's partner had worked in Azerbaijan and returned to Alaska about 4 months prior. Since the virus was more closely related to those Old World orthopox viruses than the New World orthopox viruses, investigators wondered whether he'd somehow brought the virus home with him. But there was no evidence he was recently infected, nor was there evidence that the infection occurred due to an imported fomite. A limited small mammal trapping effort at the time also did not yield any evidence of a zoonotic source. Next slide. On August 19, 2020, the same clinician who cared for the first Alaskapox case saw a different and unrelated patient with a similar complaint. This young woman presented with a small gray lesion on her left upper arm, followed by redness 4 days later. She also had tender lymph nodes, shoulder pain, fatigue, and subjective fever at night. The similarities between the two cases were notable. Both had skin lesions on the upper arm or shoulder, both presented for care in the summer, and both lived in the vicinity of Fairbanks, Alaska, less than 10 miles apart. Given the similarities between the presentation of the 2015 patient and the new patient, the clinician de-roofed the lesion and a sample was submitted to CDC for orthopox virus PCR testing. The specimen tested positive on a generic orthopox virus PCR assay, and to follow up, whole viral genome sequencing was performed. The results were consistent with Alaskapox virus. The sequence of the 2020 isolate was greater than 99% identical to the 2015 isolate. Next slide. Once the Alaska Division of Public Health was notified that the second ever case of Alaskapox virus had been confirmed, we began the epidemiological investigation. There were no international connections. She had not traveled outside the state in the prior 3 years, and the patient had no known contact with anyone with a recent history of overseas travel. There also wasn't any evidence of direct person-to-person transmission. She had no recent intimate partners. The patient lived with one other person, but the patient reported that that family member had no symptoms of any kind. And she did not know of any coworkers or extended family members with a similar illness. Finally, there wasn't evidence of infection via an imported fomite. She did her own laundry, and she had not worn any new, borrowed leather or unusual clothing items. Next slide, please. But she had spent time outside, and she did have contact with animals. The patient owned 2 cats, one of which reportedly hunted small mammals, though the patient denied ever touching the small mammals or seeing any small mammals in her home. As far as she knew, the cats did not have any skin lesions or other signs of illness. She also had contact with a relative's dogs. She denied any bites or scratches. Approximately 10 days before her symptoms started, the patient spent parts of a few days picking berries. She did not report seeing any small mammals while picking berries, but the site was near a forested area with many small mammals. By late September, the patient's lesion was healed with just some dry skin remaining. While the epidemiological investigation did not support any definite conclusion about where and how the patient got infected, a zoonotic source was looking more and more plausible, not least because there wasn't evidence to support an alternative explanation. And so we turned our focus to animals. Here, Florence will take up the story. Next slide, please.
In a collaboration between the Alaska Division of Public Health, the University of Alaska Museum, and CDC's Poxvirus and Rabies branch, we trapped small mammals in peri-domestic locations around Fairbanks and sent samples to CDC for Alaskapox virus screening. Shown here are the 3 different kinds of traps we used. From left to right, tomahawk traps for larger animals, Sherman traps for smaller animals, and pitfall traps for shrews. Next slide, please. We set live traps at 6 locations, including at the patient's home over 6 nights. The amount of trapping is quantified as trap nights, which is the sum of the number of traps set each night. In total, we trapped for 1,104 trap nights. Most of the locations were within a few kilometers of the 2020 patient's home. All of the sites were located in mixed evergreen and deciduous forest, adjacent to low-intensity developed areas. We also chose one location in a different area near Fairbanks, about 13 kilometers from the patient's home. Next slide, please. We humanely euthanized the trapped animals and collected samples. Samples collected from the animals included serum, dried blood spots, skin, liver, kidney, spleen, heart, and lung. Next slide. Altogether, we collected and sampled 176 animals. Redback foals comprised almost 85% of the animals collected. Other species included shrews, voles of the genus Microtus, northern flying squirrels, and red squirrels. One porcupine was sampled after it was found freshly killed by a vehicle near our processing site. Next slide. By far, the most frequent animal collected was the northern redback vole, Myodes rutilis, a small rodent common throughout Alaska, whose range extends throughout the Arctic regions of North America, Europe, and Asia. Next slide. Samples from each animal were tested for evidence of past and current orthopox virus infection. 30 animals, including 28 redback voles, a flying squirrel, and a red squirrel, had detectable IgG antibodies on a generic orthopox virus ELISA assay. This indicates that they had an orthopox virus infection in the past. Note, however, that this assay is not specific to Alaskapox virus. Next slide, please. 13 animals, including 12 redback voles and 1 shrew, had detectable viral DNA. All 13 were positive on both a generic orthopox virus and an Alaskapox virus specific PCR assay. Next slide, please. Viable virus was isolated from 2 animals, a redback vole and a shrew. As of yet, we do not have sequences from these isolates, but when we do, we'll be able to see how they compare to Alaskapox found in humans. Next slide. Here are the data broken down by location. Each bar represents the number of animals trapped at each of the 6 sites. The green portion of each and the number to the right represent the proportion of animals from each site that tested positive for anti-orthopox virus IgG antibodies. Antibody-positive animals were collected from each site, including the patient's home, marked here by an orange house icon. Next slide. In this figure, similar to the last one, the blue portion of each bar represents the proportion of animals from each site that tested positive for Alaskapox virus by PCR. PCR positive animals were collected from 4 of 6 sites, including the patient's home. Next slide. Here are the same data side by side for comparison. Site F was about 13 kilometers away from the patient's home on the other side of the city. This suggests that Alaskapox virus infection in animals may be widespread throughout the Fairbanks area. More research is needed to understand the geographical distribution of the virus. Next slide. To wrap up, here are some of our conclusions about where our knowledge of Alaskapox virus currently stands. We believe this virus is endemic to Alaska. Even if we ignore our small mammal findings, it seems exceedingly unlikely that the virus is native somewhere else in the world would be only ever identified in 2 people in the same part of Alaska. Alaskapox virus infection in animals is likely underdiagnosed, but to what degree is unknown. And aside from our limited data from animals from 6 locations near Fairbanks, the geographic distribution of the virus is also largely unknown. We believe that Alaskapox virus is zoonotic. The timing of the infections in the summer and our animal data support this conclusion, as does our subject matter knowledge of orthopox viruses in general. It will be important to conduct phylogenetic analyses to understand how the virus found in humans compares to that in animals. If Alaskapox virus is zoonotic, that raises many questions. What are the transmission dynamics in animals? What roles do different species play? And how does it spread to humans? The fact that both patients were identified in an outpatient setting and that their lesions resolved suggests that Alaskapox does not cause severe illness, but with just 2 documented cases, much is unknown. Finally, we conclude that person-to-person transmission is not common. We don't have any documented evidence of it happening, but we cannot conclude that person-to-person transmission never occurs. Indeed, if person-to-person transmission is rare, it is likely that by chance alone, many clusters would consist of a single case. Next slide. We have many people to thank for this work. Many people made this investigation possible. Dr. Zach Worley is the clinician who saw both patients, and Professor Link Olson provided expert guidance on small mammal trapping in interior Alaska. Next slide. We're looking forward to taking your questions at the end. Here are our email addresses. Thank you so much.
Thank you. Next slide, please. Our next presentation, Agritourism on U.S. Goat Operations, is by Dr. Natalie Urey. Please begin when you're ready.
Hello, everyone, and thank you for the introduction. So my name is Dr. Natalie Urey, and I'm a veterinary epidemiologist with the USDA National Animal Health Monitoring Systems. Next slide, please. So before we get started, I just want to give a brief overview of what agritourism is defined as for this study and the One Health impacts. So agritourism is tourism on agricultural operations where the public is invited to tour a farm and partake in farm-related activities. Goat agritourism is a growing industry and often involves feeding and playing with goats, goat yoga classes, and goat product sales such as milk, cheeses, soaps, and lotions. Goat agritourism is a fun and generally safe way to introduce both adults and children to livestock and agriculture. However, there are risks to visitors and animals when operations participate in agritourism. Agritourism public health risks include physical safety, food safety, and related considerations, including zoonotic disease transmission. A zoonotic disease is a disease that can be passed between animals and humans. Even healthy animals and humans can transmit disease-causing pathogens. Common bacterial pathogens associated with goats include Campylobacter, E. coli, Salmonella, and Coxiella burnetii, the causative agent of Q fever. So these operations should have best practices to mitigate risks associated with pathogen exposure and to prevent injury. These can involve farm design and public access area considerations, communicating risks and policies to the public, and cleaning as well as disinfecting practices. So this PowerPoint presentation is going to review current management practices on goat agritourism operations from data collected as part of the NOMS Goat 2019 study and discuss areas for improvement that will decrease risk for the operations participating. Next slide, please. So a quick overview of NOM studies. NOM studies are nationally representative cross-sectional studies that are designed in collaboration with industry to answer questions and information gaps in various agricultural sectors. All NOM studies are voluntary, and therefore we rely heavily on producer buy-in, which means data confidentiality is of utmost importance. Next slide, please. So here's a quick overview of all of the biologic samples that were collected as part of the NOMS GOAT 2019 study. I just want to point out that we did collect enteric microbe data and vaginal swabs, which we tested for Coxiella burnetii with collaborators there at CDC, along with serum that was tested for Coxiella antibodies as well. Next slide, please. Oh, thank you. So these are the states that participated in the NOMS GOAT 2019 study. The study itself consisted of 2 phases. A questionnaire was completed in collaboration with the National Agricultural Statistics Service. And then there was the Veterinary Services Questionnaire, which included an agritourism component and biologic sampling. Overall, we had 60% of operations complete phase 1 and 60.5% of eligible operations complete phase 2. Next slide, please. The completion of the on-site agritourism questionnaire was completely voluntary and only available to operations that completed the VS phase of the study, which included the VS questionnaire and biologic sampling. It is possible that some operations that participated in agritourism activities did not complete the questionnaire as they did not classify themselves as an agritourism operation, or they chose to opt out of the questionnaire. And therefore, some agritourism operations that were enrolled in the study will not be represented in these results. However, all operations that completed the questionnaire qualified as agritourism operations since they allowed the general public onto their operation other than into their home, and the general public had access to areas or facilities on the farm that housed or contained animals, feed, manure, or farm equipment. So we had 86 operations complete this questionnaire, and given the small number of operations that completed the questionnaire, these data are not weighted back to the general population and are not broken down by herd size, region, or primary production of the operation, which is what we normally do for a NOMS study. With that, next slide, please. So now I will go on to discuss the study results from the agritourism questionnaire. Next slide. So the months in which agritourism occurs and the number of people that visited the agritourism operations may impact the overall risk to visitors. On average, agritourism operations had visitors 68.4 days per year. A higher percentage of visitors occurred in the spring and summer, and fewer visitor days were seen in the winter months. The average number of annual visitors per operation was 1,393 visitors. However, 51.8% of operations had less than 100 visitors per year, and 4.7% of operations had 5,000 or more visitors per year. The highest percent of visitors were seen in April, which coincides with kidding season on many operations. Although watching animals give birth and interacting with newborn kids is exciting for visitors, these can increase pathogen and safety risks. Additionally, 10% of visitors toured operations in September, which likely overlaps with other farm fall activities such as hay rides and pumpkin or apple picking, which can increase safety visitor concerns as well. Next slide, please. And there we can see the kidding season. Thank you. 64% of agritourism operations had designated parking for visitors away from regular farm traffic. Next slide, please. Thank you. This is important to minimize potential contamination of visitor cars and to minimize the risk of accidents. Of those that had designated parking, 34.5% had designated parking areas downhill from any animal facilities, manure storage areas, or crop fields that were fertilized with animal manure. That means that during times of increased rain, there is a potential that the parking lot may become contaminated with manure. Also, 40% of operations that had a designated parking area had a location that shared a fence line with an animal pen or pasture. Therefore, there is a potential for visitors to have contact with animals in an unsupervised environment. Next slide, please. Next slide, please.
I think we may be having some technical difficulties. Hold just a second.
Thank you.
Apologies, everybody. Hold on just a second while we get the slides back up.
Laura, this is Helen. I'm going to pull up my slides to share in just a moment. Thanks.
Thank you, Helen. Apologies for that, everybody. Dr. Yuri, you can continue when you're ready.
Thank you. And can we go back just one slide, actually? Perfect. Thank you so much. So overall, the majority of agritourism operations allowed visitors to access the general goat housing areas. General goat housing areas and milking areas are considered low-risk locations for zoonotic disease transmission compared to the kidding areas and manure piles or manure storage areas, where visitors may come in contact with enteric microbes such as E. coli and Salmonella. A smaller percentage of operations allowed visitors access to the kidding areas and manure pile or storage areas, which is great because, as I said, these are higher risk areas on the operation. Next slide, please. Most operations allowed the public to interact with weaned kids and other non-kidding adult goats and other animals, with the most common other animal being poultry. Really, the only animals most often restricted were newborn kids and does that were kidding, which is good and shows some awareness of concerns, as does that are kidding can potentially spread Q fever and newborn kids can potentially spread enteric disease. So we're excited to see this. Overall, 53.5% of operations allowed visitors to feed goats. These operations had various permitted feeding methods, with 89.1% of these operations allowing visitors to hand or bottle feed from outside the pen and through the fence. 63.1% allowed hand or bottle feeding inside the pen, and 6.5% allowed feeding through a one-way feeding tube. Feeding goats, and especially young kids, can be a very rewarding event for agritourism visitors. However, feeding goats with any method besides a one-way feeding tube increases contact with goats and potentially increased spread of pathogens. Additionally, if the feeding activities are not directly supervised, it may be dangerous for the goats, as they could receive too much food and potentially not receive a full feeding. Next slide, please. And there we're just highlighting those two restricted areas. Next slide. The transition area can be physical or conceptual. It's a space with no defined barriers that separates animal areas from non-animal areas. And a transition area differentiates where animals are available to visitors and where animals are no longer available to visitors. There could be multiple transition areas, one into and one out of the animal area, or a single transition area into and out of the animal area. Operations completing the on-site agritourism questionnaire received the figure posted above to help explain what a transition area was. In general, transition areas should help facilitate movement in a manner where safe animal interactions occur and the risk of disease transmissions are mitigated with signage, movement control, and hand washing stations. In regards to visitor flow, 83.7% of operations used a guide to escort each visitor through the goat visitor areas. Of those that did not use guides, 84.6% allowed visitors to move freely throughout the area. So it wasn't a one-way flow and it was not directed two-way traffic. Overall, 53.5% of operations had a defined transition area. Next slide, please. Most operations had required policies for visitors, with the most common being they required supervision of children in animal areas and prohibited smoking in the barn. 98% of operations communicated policies verbally, while about 1/5 had signage communicating their policies. Most operations had policies regarding smoking in the barn and supervision of children, whereas fewer operations had policies that would help prevent disease spread. Most operations warned visitors regarding any risks, with most warning visitors about physical safety risks related to touching animals. Of operations that warned visitors, 97% of operations communicated these warnings verbally, and 10% communicated warnings with signage. So increasing policy and warning communications, especially through signs, will help ensure that visitors are aware of potential risks and stay safe throughout the visit. Next slide, please. The location and presence of hand washing stations available on operations are important to help minimize the spread of pathogens. Hand washing stations can be simple, but they should provide water, soap, and a method to dry hands. Hand washing stations should be present in areas where visitors can touch animals, near restrooms, and in any location where food can be consumed. Hand sanitizer is not a substitute for hand washing, but it can be provided in addition to hand washing. So 70.9% of operations had hand washing stations with soap and water available to visitors when they exited the goat visitor areas. Also, I want to note that 57% had hand sanitizer available to visitors when they exited the goat raising area as well. Next slide, please. Thank you. In regards to cleaning and disinfection procedures on these agritourism operations, goat visitor areas were cleaned of manure and debris on average 3.5 times per week. About half of all of the surveyed agritourism operations disinfected the goat visitor areas, with 18.6% disinfecting after every cleaning and 12.8% disinfecting several times a year. Next slide, please. And you can just click one more time, please. Thank you. Animal care and protocols on operations have important public health implications. Veterinarians are integral to the development of safe agritourism health protocols, yet they are not commonly involved in the operations protocol development. 61.6% of operations had a protocol in place to make sure that employees removed animals showing signs of illness, such as diarrhea, fever, or coughing, from public visitation, and 18.9% of these operations involved a veterinarian in developing the protocol. Next slide, please. And you can click one more time. Thank you. So 36.2% of operations had food or drink available for visitors as samples or to purchase. Of those that had food or drink available to purchase, 10.7% served food and drink in an area where animals had ever been kept or where there was possible contact with animals. 39.3% served unpasteurized products such as cheese, milk, or yogurt, or fruit juice, and 82.1% had hand washing stations with soap and water available to the farm visitors at the entry of the food service area. 46.4% of operations had hand sanitizer available to visitors in the food area. Next slide, please. Lastly, 57% of all surveyed agritourism operations had met with an insurance agent about protecting their farm through policies for an agritourism operation. Of those that had met with their agent, 83.7% had added policies specific to public visitation on their farm. We hope that asking this question may have provoked more agritourism operations to talk to their insurance agents about specific policies to help protect their operation and visitors. Next slide, please. For more information, please visit our website. We have multiple infographics and info briefs available in English and Spanish. And if you have any questions regarding this information, feel free to contact me at my email located there. So with that, next slide, please. Our next steps will be to publish the agritourism report and analyze those biologic results that are related to the agritourism results as well. Next slide, please. I would like to acknowledge all the folks that helped and participated in our agritourism study, all the goat producers that were involved in the NOMS Goat 2019 study, and especially all of our veterinarians and field staff that helped with the study. Next slide, please. With that, I am all done. Thank you so much.
Thank you, Dr. Yuri. Our final presentation, SARS-CoV-2 in Asian small-clawed otters housed at an aquarium, Animal and Public Health Management Consideration, is by Drs. Chelsea E. Anderson and Amanda Felpash. Please begin when you're ready.
Thank you. Yes, I'm Amanda Felpash. I'm a One Health medical epidemiologist at the Georgia Department of Public Health.
Sorry, I didn't unmute. You can go ahead to the next slide. I'm Dr. Chelsea Anderson. I'm one of the staff vets at the Georgia Aquarium that clinically cares for our animals. Just a quick overview. The Georgia Aquarium closed to guests on March 14th, and we drastically restricted our staff. We had no volunteers. They were all asked to stay home. We've developed 3 teams, 2 that were non-overlapping, basically team A and B that covered the day-to-day duties at the aquarium. And then we had a 3rd team that was at home on reserve in the event that team A or B fell ill and we needed to replace that whole team. We canceled all elective veterinary procedures and only provided essential care. And then all staff had travel restrictions for a period of time. Face coverings were initiated on April 13th and temperature checks were started pretty early, about March 20th. We did start to have ability to travel in late June, but there was staff quarantine requirements that followed with that. Next slide. Oh, that's one too many. Just to kind of give you a little more info, we did start to phase back volunteers over the summer. Dive operations started in late May, early June. They help with us with maintaining our habitats and doing a lot of cleaning and maintenance. So that was really important to get back in front of house staff, and then other volunteer learning opportunities came back in August. We loosened our team management on an individual basis in July of 2021. We also started staff contact logs in October of 2020 per CDC guidelines so that we could track who we were exposed to if we ever had a staff member come positive. And then we fully broke down our separate teams this past April and May, and travel quarantine for staff was lifted about 2 weeks ago because we are 60% vaccinated in our workforce. Next slide. This is going to talk about guests and how we've managed with guests. Again, the building closed on March 14th and it reopened June 13th or 15th, depending on members versus general public. At that point, it was a 30% capacity and masking was encouraged. Masking was not required, sorry, no, something's covering it, until July of 2020. We are just starting to bring back very few animal interactions and behind the scenes tours, and our temperature checks for guests just expired last week. So those were our precautions, and we're at about 60 or 70% capacity right now. Next slide. So this is an Asian small-clawed otter. We have 7 here at the Georgia Aquarium, 5 female and 2 male, and they're all geriatric with various underlying medical conditions. Next slide. So I have a couple of photos to show you. This is what we call behind the scenes. So there are several connecting animal holding spaces, and actually the common area where the staff are standing, they can shift animals into those areas as well. Next slide. Some of those have above ground pools, some have underground pools, and some are completely dry spaces. This is just to show you how the staff work the animals in what we call protected contact. They can ask the animals the behavior and then feed them through these slots. And that's how we typically interface with them. Their distance is probably 1 to 2 feet. They're pretty close, but they were wearing masks. Next slide. To then show you front of house, so this is where the guests would be. That plexi barrier is probably at least 8 feet high. The animals have water space and dry space. And then there is an area above where guests can walk to, but it's from a pretty far distance. Next slide. In mid-March, all 7 were reported to have some mild lethargy and decreased appetite. Next slide. We didn't think a whole lot of it until April 6th when we started to see our first respiratory signs, coughing and sneezing. Next slide. Which progressed through more of the animals. So we went ahead and did voluntary radiographs, meaning behaviorally trained, no anesthesia. And those were pretty unremarkable. Next slide. Which then progressed to by the 13th, all of them were coughing and sneezing and having nasal discharge, mostly clear, but some kind of opaque like this otter. Next slide. So at that point, we made the decision to contact the state veterinarian for guidance on should we test for COVID, among many other things. Next slide. To which they said yes. So on May 15th and 16th, we tested 3 otters each day. So we tested 6 out of the 7 otters. The 7th otter has a history of idiopathic epistaxis, so we did not elect to swab her nasal passage. Next slide. The otters had to be anesthetized for this. They're not trained for those kinds of diagnostics. Next slide. And just to show you how far we went into their nasal passage for those swabs, that just kind of shows you their oral pharynx as well as their rectums were swabbed. We tested for a variety of canine and ferret respiratory diseases to make sure, hopefully, we could identify what was going on. Next slide. On April 16th, I got first word that the first 3 otters were positive. Next slide, which meant that the following day, Saturday, April 17th, husbandry staff and some of our vet staff began getting tested. Ultimately, anyone who was in contact with the otters or otter staff was tested. Next slide. Georgia Aquarium is pretty transparent about our animals. We like to be able to share that with the public and control the narrative. So we did put out a statement saying that they did test positive. Fortunately, all the otters had very mild symptoms and they've all made uneventful recoveries. They didn't need any medical support throughout their course of disease. Next slide. We did talk at great length with USDA, CDC, the state veterinarian and epidemiologists about when can the otters come back to habitat. And we talked about a lot of different things, but really it came down to whenever we feel like we need to put them back or we'd like to put them back on habitat, we could, because we did pull them off habitat for about 4 to 6 weeks. And ultimately they said it was based on the animal's welfare and how they were doing. Next slide. So once we knew the animals were positive, we started heightened disinfection, deep cleaning, both the gallery side as well as behind the scenes, and then incorporating Virkon into our foot baths and routine disinfection. Staff began double masking with an N or a K95 mask with cloth on top of that, cloth mask. They wore an outer layer or rain suit or a Tyvek suit over their uniform because staff did have to go to other areas in the building. And they wore gloves, and then we limited how many staff were in there. And again, the animals were pulled off habitat. Next slide. By May 15th, and honestly, probably by around the 1st, all the otters resolved their clinical signs. And we were starting to see, have some reports of some over grooming, probably from the extended period behind the scenes. Next slide. And that's just to kind of show you that they're all cleared up. Next slide.
All right. So coming over to the public health side, before we get into results, we wanted to touch briefly on testing for SARS-CoV-2 in animals as it's related to our key points about collaboration. Overall, it's recommended that a One Health approach is taken in making these decisions. While routine surveillance is not recommended in animals, there are resources and a table available on the CDC evaluation for SARS-CoV-2 testing in animals that provides support for assessment by veterinarians and other animal care staff when considering testing. The aquarium's process here was a perfect example of this One Health approach as they assessed their animals clinically and reached out to state animal and public health officials to discuss and make a collaborative decision on testing for SARS-CoV-2 while also pursuing other appropriate testing. Next slide. So getting into the PCR results of the otters, The University of Georgia Veterinary Diagnostic Lab initially identified the positives, and samples were then sent to NVSL for confirmation due to this being a new species. Of the 6 otters tested, 5 were determined to be positive by a PCR for SARS-CoV-2, which was consistent with the UGA findings. Samples for the 5 PCR positive otters were sent for whole genome sequencing. This showed a B117 variant lineage. In Georgia, surveillance data indicates that B117 is and was circulating at high proportions, so this is not a surprise. Next slide. In addition to PCR testing, the aquarium had banked serum samples from the otters spanning from 2018 to 2021. In collaboration with federal partners, some were identified for testing via a fluorescence-based complementation assay with a receptor binding domain, or RBD, IgM, and IgG target. Next slide. Not all otters had samples available from every time point, but all 6 did have associated serum available from the mid-April PCR collection dates. This is a large table, but 3 of the otters did test positive on serum samples collected in mid-April associated with the PCR testing. All available samples from 2018 through January 2021 were negative. Next slide. For a PCR and serology combined look, we see that one of the positives on serology results was negative via PCR both at UGA and NVSL. We know antibody response takes longer to develop and may be detected longer than viral shedding can be detected with PCR. The 3 positives from serology were some of the first 3 otters to show mild symptoms and gives us something for consideration in their infection timeline. Next slide. Overall, this has been an incredible One Health interconnected follow-up and investigation. There has been great collaboration across many organizations and disciplines. On the human side, due to the aquarium's relationship and groundwork that they had laid with a certain lab for employee testing program, it was possible for persons to be tested quickly and also with the use of PCR. This also made it possible for us at Public Health to obtain the original samples for sequencing. We also worked with human resources at the aquarium and our local health department workplace coordinator to review their infectious disease plan. This plan was robust and really excellent, but this gave us the opportunity to provide some feedback on the quickly evolving COVID guidelines, which included the travel restriction lift Dr. Anderson mentioned. On the animal side, sequences were obtained from the otters to compare with human sequencing results. As already described, housing and protocols for interaction with animals were reviewed, and banked serum samples were provided to contribute to the scientific picture around the positive otters. Together, this all contributed to valuable and tangible outcomes, as well as incredible collaborations to build on in the future. Next slide. So touching on transmission in this situation and what we know, for any positive person for COVID-19, regardless of how they're connected to any situation of interest, human investigations are done per DPH and CDC protocols. We have district-led case investigators in Georgia, and they are typically done quickly in cases where contact information is appropriately provided by the lab or provider reporting the case. Additional interviews may be done in certain situations, and were done in this case. Samples were obtained for sequencing, and we are working together with federal partners to compare the results of human sequencing and otter sequencing. That said, we realize results will give us information about genetic similarity, but not about directionality. Given all factors, we do believe that exposure for the otters most likely happened by an asymptomatic caretaker, unintentionally, of course, but we do not know if another human may have been involved who was not identified in the testing event, given the broad timeline. So although we will have much more information soon, we will obviously unlikely be able to identify the specific time or source of infection. Next slide. In summary, new species present new challenges. A lot of this stuff is things that you all already know, but just things that we learned were really important is just keeping up with reliable sources on the most up-to-date guidance. We're learning new things every day, as is noted in these calls. On the human side, we also recommend considering updating workplace guidance and plans often. As you all know, there are regular guidance updates at the federal, state, and local level, and having a plan that's updated may help to increase adherence by staff to precautions that are important and current if they feel that it's current to the science. Of course, collaboration is key overall, but not only in a response situation. Laying that groundwork ahead of time was also imperative in this situation. An example, again, is the groundwork the aquarium had laid with their human laboratory, which led to great success on the human investigation side, as well as all of the incredible relationships between the aquarium, public health, agriculture partners, animal health, and education were also key. Next slide. So finally, our next steps involve more collaboration. We have pending sequence analysis and comparisons to make. We hope to continue to work with our incredible partners at the aquarium to share information that is found that would contribute to the body of science as we go on, as well as working with our agriculture, federal, state, public health, CDC, and other partners that have been involved in this investigation. And speaking of which, next slide. We just want to send a huge thank you to everyone, and we welcome questions. Thank you.
Thank you, and thanks to all of today's speakers for their informative presentations, and thank you for your patience as we dealt with technical issues. We have time for just a few questions before the top of the hour. Please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic. We have a question for our Alaskapox presenters. Were any ectoparasites tested for Alaskapox?
Hi, this is Florence. We have not tested any ectoparasites, but we did collect fleas and other ectoparasites from any animals that we saw had them. There isn't any evidence of ectoparasite transmission of orthopox viruses that we know of, but it is something that we do keep in mind.
Thank you. And for Dr. Yuri, do you have any recommendations for how veterinarians can play more of an active role in risk reduction strategies on agritourism farms?
Yes, I think just having veterinarians there on the operation, being involved and mentioning that there are these risks, and that maybe noting that an operation is participating in agritourism. I think one of the things that we saw were either operations didn't really understand or know that there are risks to themselves and the animals, also to their visitors, and also they weren't communicating that they were participating in agritourism to their veterinarians. So I think the communication can be improved that will help producers connect more with their veterinarians to provide that feedback.
Thank you. And we have a question for our otter presenters. Were the otters co-infected with any other common respiratory viruses seen in this species?
No, we tested for, I don't know, 20 or 30 or more diseases. They were negative on everything except for the COVID.
Thank you. And back to our Alaskapox presenters, how common is it for humans to be infected with orthopox viruses?
Hi, this is Florence. Overall, orthopox viruses are not very common worldwide. However, there are increasing numbers and sizes of clusters of orthopox viruses in certain areas, such as in Central Africa, monkeypox, and in Colombia with cowpox. After the cessation of routine vaccination for smallpox, the thought is that a big driver of the increase in clusters is the waning community immunity to orthopox viruses, because smallpox vaccination does provide some protection against other orthopox viruses.
Thank you. And one more question for Dr. Yuri. Is there a reason noted during the study why the use of foot baths was low amongst participants? Was that an issue of efficacy or compliance?
No, we did not get into the efficacy or compliance issues at all. We just asked if they had foot baths available or not, and the majority of operations did not even have them available. So definitely an area that can be improved.
Thank you. If you have other questions for today's presenters, we've included their email addresses on this slide on the ZOHU call webpage for today's webinar and in today's email newsletter. A video of today's webinar will be posted within 30 days as well. Next slide. Please join us for the next ZOHU call on August 4th, 2021. Remember, we don't have a July call, and thank you for your participation. This ends today's webinar.